It is bilateral proliferative retinopathy in premature infants with low birth weight who have been exposed to high concentration oxygen therapy. Stages of ROP. Stage 1. Demarcation line, a flat white line between normally vascularized and peripheral non-vascularized retina. Stage 2. Ridge with progression, demarcation line develops into elevated pink ridge representing mesenchymal shunting between arteries and veins. Stage 3. Ridge with extra-retinal fibrovascular proliferation. Neovessels are leaky so retinal and vitreous hemorrhage occurs. Stage 4. Stage 3 enters into one of the following fate: spontaneous regression, cicatrization. Management. Screening. Babies born at or before 31st week or weighing 1,500 grams or less and exposed to oxygen therapy should be screened. Screening should be between 6 to 7 weeks postnatal age. Fundus is examined with fully dilated pupil by indirect ophthalmoscope. Treatment. Ablation of a vascularized retina is effective when ROP is in third stage, cryotherapy, laser photocoagulation, vitrectomy, when there is TRD. Thank you.